Welcome to this week's edition of Health Check, where myself and my colleague Dr. Nosipho Mhlanga remind you to check in on your health. Now, we'd love to hear from you, so please engage with us on our social media platform. You can try this on TikTok, Facebook, and Instagram if you have any questions or comments. The condition we explore this week can be hard to go unnoticed walking around in public. Now, many of us might have come across someone who's developed this condition. Sometimes known as elephantiasis, lymphedema is an abnormal long-term swelling of a part or parts of the body caused by a collection of lymphatic fluid. But before I get ahead of myself, let's join Dr. Nosipho as she checks in with someone living with this condition.
Today we're in Tembisa to meet what I'm told is a fabulous lady, Me Maria, and we're going to find out how she lives and thrives with lymphedema.
Socialize angisakhoni ngokuphumela ngaphandle ebantwini ngesikhathi eside because ngicabanga ukuthi if ngihambile angikhoni nokulala phansi angikhoni if anginabed la ngiyakhona siyayibona so iyangi-affecta kakhulu angisayenzi zonke izinto ebengizenza impilo yami seyehlile angisayenzi but esontweni khona ngiyaya. I don't miss church. I can miss every other thing but not church. My name is Maria Ndababo Nchakatla. I'm 61 years old and I've been in this house for the past 40 years, I think.
Siyabonga makusamukele emzini wakho. Can you just tell us a little bit about yourself? Then ungasitshela ukuthi impilo before uqala ukugula beyinjani?
Mina bengi-right nje, bengumuntu active kakhulu emsebenzini, esikolweni, esontweni, everywhere. Yes, until 2008, I fell and broke my ankle. From there and then, azangisaba right. Yeah, bengisebenza kwi-Department of Health, head office eJohannesburg. So beyingihlupha kakhulu inyawo because bengi-driver. The left ankle, yes. Ngaya esibhedlela. In fact, ngaya eTembisa Hospital. Then bathathe X-ray, bathola ukuthi ine-fracture and enkulu. Ngacela incwadi, then bangireferela to RVP Hospital. So RVP bathola ukuthi ngilimele kakhulu. Then ngiye-admit to RVP for 3 weeks. Bangifaka i-plate nama-screws. I-5, I think. 2 years after lapho, labuyela, bayokhipha ama-screws I-4, bashiya AC1. Then ukuhamba kwesikhathi ngaphola, ngazwa ukuthi ngipholile. Sengipholile njalo, ngabuyela emsebenzini. But then again, ngisemsebenzini in 2021, eTembisa Hospital bengisebenza khona. Ngawa futhi
khona emsebenzini ngamadolo oyi-2 avuvuka amadolo ngaya casualty bathatha i-X-ray bathi akuna fracture. It was a Friday ngihleli la ekhaya weekend yonke. Sunday thokuthi sewavuvuke kakhulu oyi-2. Monday, I had to go back to my doctor. Lo bekangitreata i-ankle, my orthopedic surgeon. Wangichecka wabithola ukuthi akuna fracture. And then i-diagnosis ye-lymphedema yona kuleso sikhathi ifike nini? When did someone say that it was lymphedema?
Ngoba avuvukile ngaya kuma-X-ray, ngaya kuma-Doppler. Athola ukuthi akuna nama-clot or anything. Then wangitreata, wangithumela ku-physio. I attended the physio, I think, for 5 sessions. Kungabi ne-progress. The other one, labuyela idolo. Linyawo labuyela back to normal. But this other one was growing bigger and bigger. So, orthopedic surgeon wangireferela komunye futhi doctor Albertine. Lawyer wangireferela to occupational therapist Albertine. So for now, ngithatha ama-treatment khona. Khona ama-test abebayawenza. Kodwa angazi ukuthi bekuyi-1 kodwa mabangifaka
sort of ink or in by injector lapha enyaweni. On the left-hand side, ukuthi ink le iyahamba until phezulu. Then ngapha kule nyawo elibuhlungu iyahamba just below the knee ayisachubeki. So iyo leyo test leyo confirma lymphedema.
And besides the swelling, akhona amanye ama-symptoms obowunawo besides just the swelling of the leg lokho bokungapheli?
Angazi mina ngi-diabetic, ngi-diabetes, ngi-chronic, cholesterol, and ngike ngaba ne-hernia of the umbilical. After leyo hernia, azangiphole, yaba septic kakhulu. Then I went back, but nga-admitwa in Pretoria, eMulmed. Nga-admitwa khona, not eMulmed, eLouis Pasteur. Before eMulmed, bengihamba ama-treatment. eLouis Pasteur, bathola ukuthi i-septic and fanele bayoyisika futhi. And bayisika kakhulu, bayigubha. Bashiya bekunomgodi nje omkhulu. Azange bawustishe because basabuthi izoba septic futhi.
And then by the time so uyakule occupational therapist abakuthumele kuyo.
Yes.
Uke wabona ukuthi inyawo bese liba ngcono, bekukhona into eshintshayo noma bekuloke kusafana?
No, akunanto eshintshayo until occupational therapist bathi ngisebenzele ekhaya. Then that's when libeqala ukuba ngcono ke ngoba bese ngiba ekhaya ngingasa drive. Yeah, so since ngisekhaya, it's only then kuba ngcono. But so lokho nje bengiyemsebenzini belingabi ngcono. But since ngisekhaya, ngiyakhona ukuthi every time ngiyena ngiyekamereni, I put my cushions elevate bengcono, and then ngisebenzisa nama stockings.
Compression stockings.
Compression stockings, yes.
I know that the tutorials on how to drain the lymphatic system are becoming more and more popular on social media for different reasons. But Dr. Silo, I think it's time that we set the record straight and let our viewers know the facts about the lymphatic system and how it works from our experts.
After the break, we hear from our expert, and Dr. Nosipho continues checking in with Memaria. Stay tuned. Welcome back, and thank you so much for staying with us. Now, the primary function of the lymphatic transport system is to drain lymphatic fluid. Now, this is a clear, colorless fluid containing water, proteins, white blood cells, waste, and other materials from different parts of our bodies. Now, this fluid is then filtered through the lymph nodes, then drains back into the large veins, and it is pumped back to the heart, where it is eventually removed from the body as urine through our kidneys. So should you have any questions or maybe some concerns about lymphedema, please don't hesitate to comment on Health Check SA, your favorite social media platform. But for now, we're joined by occupational therapist Natalie Powell from the University of Witwatersrand. Now, after working at Baragwanath Hospital in plastic surgery, burns, and the hands unit, Natalie began her passionate work in lymphedema management, and for over 14 years at the Alberton Clinic. She's also executive member of the Lymphoedema Association of South Africa. Natalie, welcome to our show.
Thanks for having me.
All right, so before we start talking about lymphedema, perhaps let's start with the basics. The lymphatic system. What is this, and why do we need the lymphatic system?
Okay, so the lymphatic system is part of our immune system, and our immune system is important in fighting infection and basically keeping us healthy. The lymphatic system drains fluid from the interstitium, the spaces in amongst cells, that actually leaks out of our circulatory system. And then what happens is the lymphatic system cleans that all up and takes it back into the circulatory system. And in doing that, it picks up debris from dead cells. The lymphatic system also carries macrophages, cells that are responsible for fighting infection. And as it's passing through the lymphatic system, those cells are working to fight infection. And all of that then goes back into the circulatory system. It's then processed by our kidneys and liver, and that waste is let go.
Right. So it's almost like the sewage system of our bodies, if you like. Some people have described it as the sewage system. Is that correct?
Fair enough. I think it's a little bit more complex than a sewage system, and maybe a bit more advanced, fancier than a sewage system.
Right.
But it plays a really vital role in keeping fluid balance.
Right.
And making sure that we're healthy.
Okay, so let's then talk about lymphedema. How does that happen then in what you've just described?
So in lymphedema, there is a lymphatic system that is not functioning optimally. It can become overwhelmed, or if the lymphatic system is underdeveloped, that lymphatic system isn't moving enough fluid out of the body or moving the fluid as quickly as it needs to. So then what we start seeing is a limb or a body part will develop swelling. And that swelling can gradually increase over time. And it's something that's chronic. It doesn't go away. It doesn't fluctuate. It just stays there.
Are there perhaps any, differences in levels of severity in this swelling that you've just described?
Lymphedema is staged, depending on the signs and symptoms that we see, from stage 0 to stage 4. Stage 0 is usually subclinical lymphedema. That's usually when there's been damage to the lymphatic system in surgeries that are done in treating oncology patients, for example, where they remove lymph nodes. So there's no clinical swelling, and we don't see the swelling, but because there has been damage to the lymphatic system, the patient is classified as a stage 0 patient.
So only the health professionals can know, but someone who's suffering from lymphedema stage 0 will not be able to see or recognize that they have a problem.
No. So usually in those situations, as lymph therapists, and we hope other healthcare professionals who are dealing with those patients will educate the patients that because they've had a surgery that has impacted the lymphatic system, that they would be classified as stage 0, or at least if they don't tell them that they're stage 0, that they make them aware that they are at risk for developing lymphedema. They may never develop clinical swelling, but they might.
We'll pick up on that risk issue for now, but let's just carry on. So you've described stage 0, where there's no obvious symptoms as such. And any other levels of severity?
So then we move from stage 1 through to stage 4, stage 4 being the most severe lymphedema. Stage 1, the patient would start developing, they would have swelling that it doesn't go away. It's generally quite mild. And as the edema increases or changes in severity, we start seeing skin changes. And in skin changes, patients start developing hyperkeratosis, which is like wart-like bumps on their skin. They get quite dry skin. They can develop pigmentation in the skin, and that limb shape can change. So it can become quite lobular, and they can become quite disfigured as the stages, they go through their stages.
So let's go back to that risk element. The question then is, who's more at risk of developing lymphedema? And from your experience, what sort of patients have been exposed to? I mean, is this first of all a common condition? And who tends to suffer from this condition?
There's 2 different types of lymphedema. We have primary lymphedema and we have secondary lymphedema. Primary lymphedema is usually where there's an issue with the development of a lymphatic system in utero, or there may be a genetic condition that the patient suffers from that causes an underdevelopment or a lack of development in certain components of the lymphatic system. Primary lymphedema is much less common. We don't see those as frequently. Secondary lymphedema, however, is because there's been an insult to the lymphatic system. And usually those insults are through surgeries mainly in our oncology patients. Whenever they when they do a mastectomy, they always biopsy nodes to make sure that the nodes are clear. If they're melanoma excisions, they biopsy nodes. So that then increases the risk of a patient developing lymphedema. The other secondary causes can be traumatic. So patients who've suffered extensive burn wounds or orthopedic traumas where there are, or orthopedic bones, where there might be soft tissue damage, so damage to the muscle and severe scarring. The scarring in the limb damages the lymphatic system, and you can sometimes get significant swelling developing there. So it's not only from cancer, there are other secondary causes as well.
Right.
So in terms of risk, when there has been a trauma to the lymphatic system, either through surgery or a trauma where a patient has had an injury to that area and there's significant scarring, those patients are more likely or at risk of developing lymphedema.
After the break, we continue with our lymphedema patient, and Natalie Powell gives us a final thoughts.
Impilo since uba ne-lymphedema ishintshe kanjani ngoba ushilo ukuthi before bowu-active bowumuntu othanda ukuzenzela izinto yini eseke yashintsha?
Ishintshile kakhulu. Okokuqala nje angisakhoni nokugcoka lento ezingibengizigcoka kanje kuyobona. And okunye angisakhoni ukuhamba ibanga elide. Yes, even in the morning ngiya exercise la ejardini. Ngikhathala masinyane. And then bese inyawo liba ngathi banami nyana, so uyabona. Ziningi izinto nebhafu. Angisakhona ukungena ebhavini. Bafanele ngiphume, kufanele kube nomuntu ozongincedisa ukuphuma ne, but ngiyatry. But in most cases sengisebenzisa ishower.
So in your journey, mina as a doctor ngijwayele ukuthi ama-patients kakhulu acabanga ukuthi the doctors are the ones that are the most important ku-journey yabo yokulapheka. And have you managed ukuthi nithole kancane imali to be able to pay for i-occupational therapy yakho lezi zinto ozidingayo?
So far bebasamibhadalile e-medical aid. So going forward kulaba ngeke bakhona ukumbhadala khona. So kula mina naye besithe sizobona ukuthi siphuma kanjani. Mina kulezi zinto azifunayo mina i-medical aid mayibhadala mhlambe leyo mina ngizogcwalisela. It just ukuthi ngibe right. Ngoba khona izinto afuna ukuzenza la nama stockings la engiwasebenzisa manje uthe awekho effective kangako. Khona kufanele ngiwathole aqinile ukudlula lapho. So yiyo lawa afuna ukuthi at least i-medical aid is subsidized.
Okay, Mama Maria, sizochecka nje inyawo ne sibone just to feel it, then uzongichazisela ukuthi inyawo lakho likuphethe kanjani.
Okay.
Mangithinta khona lapho kubuhlungu khona.
Yeah, lapho ku-ankle kubuhlungu, yes la.
The surgical scar, yilapho abayenza khona i-operation.
Yes, mabafaka i-plate nama-screws ya.
Ngalana, nala. Ngicela ungigobisela amazwane. Inyawo lona mama mawulizwa, how does it feel, your leg?
Liyashisa. Yeah, liyashisa and kuba nesikhathi like mangiceda ukusebenza la endlini. Ngizwa liyahlaba nama-pins and needles.
La ngaphansi kwenyawo.
Yes, lapha yenza.
Okay. And then ikhala ukushintsha kwekhala vele selihlala liso.
Lihlala liso.
But angizange libe dark phezulu kwaba ngcono njengoba ukuvuvukala kuyehla.
No, solo li-dark kanje. Alikakabi ngcono.
Then ukumuva inyawo yakwazi ukunyakazisa amazwane.
Yes, ngiyazisa, but la ayi-2 angiwafili. Amazwane, the third and the fourth one. Angiwafili.
At all.
Angiwafili.
Okay, but uyakwazi ukuwagoba.
Yeah, wona yagoba.
Okay. Then mangithinta inyawo akunalapho kubuhlungu khona.
lapho kubuhlungu.
La.
Yeah, lapho ankle kusoloko kuse.
Oh, from the operation.
Yes.
Masiloke sinyuka. Akukho buhlungu ne?
Akukho buhlungu.
Phakamisa kancane ngalana. Mangithinta lana uyezwa kahle.
Yeah, ngiyawuzwa izandla zakho.
Stasis is one of the most common factors that can cause lymphedema to worsen, and that is why it's so important for lymphedema patients to get some movement and exercise. But for me, what a pleasure it has been to meet Mem Maria, who is so positive and full of life.
I mean, we've spoken a lot about what goes into treatment and management of this condition that is like lifelong, the way it's described. Your final comment on the cost of managing this condition?
The cost of managing lymphedema is huge. It's because it's a chronic condition, there's always ongoing management. Patients will be in compression lifelong, and the compression hosiery should be changed 6 to 8 monthly. A custom fit garment for a patient can be 6,000-7,000 rand for a limb. And the moment they stop wearing their garmentry and stop their management, their limb will balloon again.
And your final message to patients, people out there that are already suffering from lymphedema?
I think don't give up hope. We, as an association, as the Lymph Association, work very hard to advocate for patients, and there is help out there.
Well, Natalie Powell, thank you so much for this very insightful session with you, and only wish you well in your organization going forward. We've seen and witnessed Mem Maria's active and positive outlook living with lymphedema. Now, should you think you know someone who might have lymphedema, reach out to us on our social media platform and tell us your story. But until next week, stay vibrant, stay healthy, and remember to check in on your health.